Hello, friends. Good evening. It is day 25 of A Path of Purpose. And tonight we're going to talk about advocacy. So, do you find yourself advocating for others? There's so many ways to advocate, right? So, I'm just going to talk about one way that I find myself advocating, and it's one of my favorite ways to advocate. So, as a nurse, I love advocating for clients that have been hospitalized. So, I enjoy making sure that the clients have what they need prior to coming home, and that all the services that they need have been all put in place. Because my experience is oftentimes the insurance companies want a patient out of the hospital sooner than they probably should go home. And so that puts caregivers in a very awkward position of being able to care for them if they come home unstable. So I have a story about that. Early on, I'd probably only been a nurse, I don't know, I don't even know. I think it was still within the first year. And a client, I got a call about a client who had been hospitalized, and this client hadn't been doing well, but the insurance wanted the client discharged. And I didn't feel comfortable about it. I didn't even, this client wasn't a current patient of mine, so I would have to start the process of assessment and care plan and protocols, the whole bit, right? And um, so after a couple weeks, they ended up bringing her home, but she still wasn't stable. And she should have gone to long-term care. Now that I know so much more, learned so much more, um, but I think at the time, I don't remember, but I think she didn't qualify for long-term care, so they were just pushing, pushing, pushing to get her home. Well, once she got home, I, in doing my assessment, care plan, putting everything in place, I realized how critical she really was and how unstable she really was. And so I even called her PCP for instruction, and because I just felt like we weren't in a good space. And so I ended up literally just with her every day for hours and hours, and until the point of she was placed on hospice, and her time on hospice was short. But what's so difficult for that was I myself was so vulnerable, and I didn't know how to advocate for her. She was nonverbal, and it was probably the worst situation I've ever been put in nursing. But that experience, because I don't know that anything, the outcome or anything would have changed, right? Because she was in such critical care, but um, but I did learn a lot from that situation. And so now I look forward to discharges, because I'm going to make sure when I go in there or when I talk to the care manager at the hospital that I'm going to do everything I can to get in place all the services the individual needs prior to coming home. And I'm going to make sure that that person is not coming home until they are stable. Like, for instance, let's say somebody's never been on oxygen, but while they've been hospitalized, they've been on 1 or 2 liters. And the doctor's saying, well, we're just going to send them home on oxygen. When I know once that person gets home, there is no way that person's going to keep oxygen on. Staff are going to have a difficult time. It's going to turn into a power struggle to manage this treatment. And it's like, no, we can't do this. And so we're not home health. We're not a medical facility, right? And so I've really learned that no, they weren't on oxygen before they came. And if they're only on 1 or 2 liters, I want to see them stable, because probably the issue is they have aspiration pneumonia or pneumonia, and they need to be on antibiotics for 1 or 2 more days to get their respiratory tract stable, so they are able to go home without oxygen. So that's just a little piece, but there's a whole gamut of things. So I have learned to appreciate the care managers at the hospital and really have them be an advocate for me, for the patient, because we were more times than not, a care manager has been, and they're an RN. And so they've had years of experience working on the floor with patients, and so they know what I need, and they understand the environment I work in as group homes, that we need patients that are stable prior to coming home, and we need to be able to know that we can meet their needs. So, because the truth is, when I was a kid, when you went to the hospital, your family physician came to the hospital to see you, and they managed your care. So here's a physician that's known you probably your whole life. They know you and your family. They know what you need. But now when you go into the hospital, you are seen by a hospitalist or internist, and they're great and full of knowledge, but they do not know you. They do not know your level of care that you need. They don't know your overall treatment. So they're looking at your chart on a general basis. They're not looking at you, if they're looking at you as a person, it's because they've taken the time to get to know you. They have taken the time to get to know your caregivers. And but so often they're just in and out and busy, and they just stop for a couple minutes, and they're looking at labs and x-rays results, and they're looking at everything based on paper, but they're not necessarily looking at you as a patient. So because I remember when I was a kid, and I was probably 10, broke my arm roller skating, and my parents were out of town, and I got taken to the hospital, and my family physician, I'm sure it's probably by the time they got approval from my parents, but I remember him being the one that came into the surgery room to put me under and put my cast on. And now it's just crazy to think that here was a totally aligned fracture, right, that I was put under to put a cast on. Just blows my mind. Now you just go into the clinic. If it's aligned, they just put a cast on right there in the clinic. So it's pretty funny that I had to go into surgery. So I just want to say, there's so many ways to advocate for people, and this is just one that I just wanted to share, because when you have a loved one or a family friend, whoever, that ends up in the hospital and you are part of their care team, please, please, please take the time to advocate for them, because they're vulnerable. They are in especially if they've been in the hospital for 5 days or longer, and they're weak, and it's difficult to make decisions. Make sure that they have the services they need to be able to be home, discharged to home. And be there for them at the hospital as often as you can, because again, they don't know us as individuals. They only know our diagnosis and our signs and symptoms. They don't know us on a personal level. So be an advocate for loved ones in the hospital. And I'm sure I'll have more thoughts on being an advocate, but hospitalization discharges are important to me, and I've learned to be an advocate. So, thanks for joining me tonight, and we will talk tomorrow. And just think about being an advocate and who are the people in your life that you're an advocate for. All right. Talk to you later. Bye.